we've hit phase 2, and you've heard me in a couple videos talk about the fact that it's possible that public health might recommend that we tighten up our measures again. But how do we know when to do that? In the news, you'll often hear people talk about, if there's a spike in cases, but truly that's not actually a great measure for us to go on. Instead, we need to look more at, how much spread is happening within the community where we can't explain it, but even more importantly, how ready is the healthcare system to respond, and what's going on in at-risk populations? So, for example, people over age 60. Is the healthcare system ready to respond? We need to look at, how many cases are in the ICU? How many ventilators do we have still available? Are the hospital wards being overwhelmed such that, it's hard to provide care properly? Do we have enough personal protective equipment, so PPE? So are there enough gloves and masks and eye protection for our staff to provide care safely for people? How many cases are happening in long-term care facilities? How many cases are happening in healthcare workers, especially if those healthcare workers are working in long-term care facilities? How many tests are we able to do? How many are we actually doing? What percentage of those tests are positive? And do we have things like alternate isolation facilities where for people who can't necessarily isolate at home, do we have places that we can send those people? So all of these, we have set up specific cutoffs that we would start to worry. So if our number of available beds in the ICU gets down to a certain number, certain percentage, then we'll flag that and we're going to say, whoa, red flag over here, we need to be careful. And if that gets combined with, we're running low on masks, we've had a few outbreaks in long-term care facilities, and the percentage of all of our tests that are coming back positive is going up, all of those things together, we would have to look at them and make some broad decisions. So does the total number of cases matter? Sure, the total number of cases matters. But it doesn't matter as much as when there's cases where we can't explain where they got it from, when the cases are happening in high-risk folks, and most important, when the system gets overwhelmed. COVID's not going away for a little while. We've got probably a year before we get a vaccine, hopefully sooner for some more effective treatments, but hard to say for sure. So it's not realistic that we expect that we can get things down to zero. So we're not looking for zero, we're looking for, are we ready to support you and your loved ones when you need us?